president of Christian Council of Nigeria, Most Rev. Dr. David Onuoha, said fight against HIV stigmatization in Nigeria requires active involvement from the federal government and community leaders. Dr. Onuoha, represented by Most Rev. Dr. Ogunmuyiwa, stated this at a HIV intervention close-out ceremony in Abuja on Saturday. He said we need more collaboration and sensitization from the government so that the people can be reduced. Dr. Onuoha acknowledged the government's efforts but stressed the need for greater support. Dr. Onuoha praised international agencies for their support but underscored the need for more actions, particularly for adolescents. The government's proactive role is vital. According to Dr. Onuoha, while the government is very proactive, it will bring down the figure. Now about 160,000 Nigerians are living with HIV virus and only 45,000 are under treatment. We need medical facilities to address this issue, and faith-based organizations cannot do it alone. The government must urgently fund this effort, he added. Speaking to the press, CCN Executive Secretary, Very Reverend Dr. Avance Omera, expressed concern about pregnant women living with HIV. He said the condition for pregnant women living with HIV is a source of worry to the council. CCN established a Youth Anniversary Board, YAB, to address health and well-being issues among young people. We assure the YAB and the public that the Christian Council for Nigerians will do everything in its power to enable those living with HIV to live their lives to the fullest.
So it's been a whole lot of program that we've been carrying on from time to time, from place to place, leading this campaign. And now, recently, we started talking to people who are living positive to HIV and AIDS, that they can own their lives. You don't need to live your lives in sympathy. You need to be strong. You need to be resilient. You need to show that you have capacity, and then face your lives in such a way that you don't allow anybody to stigmatize you, because HIV is not a death sentence. Somebody can live with HIV for 25 years, 30 years, as the case may be. We have very clear cases and testimonies of people who live positive to HIV and AIDS, and they are still alive, and they are pushing, and they are getting on well. So what we are doing now is that we are talking about the role that our Nigerian government should play in reducing stigma. The states that have not implemented the anti-stigma law, we encourage them to enforce it, so that when people are stigmatized because they are HIV positive, they have to pay a fine. And again, we are saying the religious leaders should stop insisting that people should bring them tests from labs because they want to wait. Testing is a personal thing. Let somebody know his or her status, and that is all, and he knows what next to do.
Taking it upon themselves to create awareness and to save life and to encourage and give hope to people is something that is worth to be praised. And looking at HIV transmission, where we want to end transmission of mother-to-child transmission among children, is a great thing. And then children that have been born with HIV, over 20 years again, they have become adult and young people now living with HIV and AIDS. We want to end that. And our greatest hope and desire is that more religious groups will come into this response to ensure that no child is born with HIV, one. Then our children that are already infected should be given an enabling environment so that they can live positively and live well, because they have life and a future ahead of them. And then also everybody, HIV is everybody's business. If you are not infected, you are affected in one way or the other. So we need to come on board, and also the religious group and the government of Nigeria to put hands together to strengthen collaboration to ensure that we end the pandemic and we end the AIDS-related death among children, among women, and among people living with HIV in general in Nigeria.
Because I experienced it. My friends never shook hands with me. My friends never came closer to me. My friends see my children and ask them, did you give back to these children in this place? I said, yes. While they are doing that, their hands are behind them. Sometimes I'm coming closer to them. Social stigma ruled the world.
Earlier we were listening about these 160,000 children living with HIV. But remember, 2 million people from Nigeria are living with HIV. Too much. And they will have partners, they will have children. In what conditions these children will be born? In this engagement with the media, we said we must prioritize the message of children living with HIV. Despite all the efforts that Nigeria did, unfortunately, children are still born with HIV. And when the parents die, it's very difficult to ensure that the family will take care of them. Some of them will be abandoned because they are seen as, as a heavy load. They are already with HIV and they are left to die. So we must change this. If these children are alone, if these children don't have a family, the church has to be their family.